We are here at the DentalEZ booth, and we're talking with Aggie Pennington. And she's going to share with us the DentalEZ concept of delivery of dental care.
Absolutely.
Can you please tell us about your unit?
Absolutely. What I'd like to do is start with the dental chair, because the dental chair is the most important part of the operatory to allow as much access to the oral cavity as possible. What DentalEZ does is designs our chair with a very thin, tapered, narrow back, and that's to allow free movement from 12 o'clock around the chair to the 7 o'clock, and to always be able to access the oral cavity. We also keep the back as thin as possible so that you are able to bring the chair down onto your knees without any obstruction. And if you'll notice, my arms are very comfortably by my side, and I'm not having to lean, I'm not having to reach my arms, which is what's causing the majority of the health issues in dentistry today.
Okay, let's talk about delivery systems. We're sitting at a rear delivery unit,
yes.
But you also provide over the patient and side delivery as well.
Absolutely.
Tell me what you can bring to each of the units. Do all of them have the same capacity?
Absolutely.
And tell me what you have.
All of our units come standard with 3 air-driven and 1 universal type holder, but they all have the capability for 4 air-driven and 2 universals. And the reason for that is because of the high-tech requirements today. All of our units have the capability to build in intraoral cameras, piezo scalers, and ultrasonics, as well as the high-speed handpieces.
What about the electric handpieces?
You also have the ability to build in an electric handpiece, and what we do is have an air-to-electric switch, so that's totally integrated into the dental unit.
And all of these are operated from the 1-foot control?
Everything is operated from the 1 control panel.
Okay. And tell me about your monitor position and your computer position in the operatories.
Well, we always recommend 2 positions for our monitor. This monitor that you see at the rear of the operatory is for charting and for patient scheduling. This can be operated by either the dentist on my side of the chair, or this arm can move to the assistant side of the chair as well. A second monitor would normally be located somewhere towards the toe of the chair or on a track mount, which was not shown in this operatory, which would be for patient viewing and patient marketing.
Okay. Is there any other feature that we should be made aware of with your product line?
I think some of the most important features on the back to the chair itself is the fact that the DentalEZ J chair and JV generation chair have an exclusive feature that also work to contribute to the health of the dental team, and that is the tilt feature. You'll see that this chair moves differently than other chairs. This movement here is called the tilt. What the tilt allows you to do is, in addition to your standard up-down, which everyone has, and also your back movement, this chair allows a different movement which cradles the patient in a modified V position. By doing that, it allows you to recline the patient further back than in any normal 2-function chair.
All right. Well, Aggie, thank you very much for sharing
Thank you.
your time with us, and thank you very much.